Hair transplantation has really been traditionally thought of as a procedure that men get. And over the last few years, we've been transplanting more and more women patients and seeing actually many more women patients for hair loss. It turns out that about 40% of women have a significant amount of hair loss in their lifetime. And in the past, women have been really, felt that the hair loss was almost taboo. And I think it's more acceptable now that women know that hair loss is relatively common, that it's not necessarily a bad thing, but just something to deal with if you can, or be treated if you can. So we're seeing more and more women in our practice. One of the most important things in managing women that have hair loss is to find the underlying cause. The vast majority of men that come into our practice have male pattern hair loss or common baldness. Where women, there's a greater number have other conditions, hair loss from medication, from shedding, due to stress, due to pregnancy, anemia, a bunch of scarring diseases that cause hair loss. For some reason, these other conditions are much more common in women than in men. So a workup is really important. So part of what we do is evaluate women for the underlying cause of their hair loss. Once a diagnosis is made, if it's a cause other than genetic hair loss, there can be specific treatments for it. With respect to genetic hair loss, the treatments are a little bit different than in men. Women can take Propecia because it's contraindicated due to possible stimulation on breast tissue. And the Rogaine sometimes is not useful in women because women don't often wash their hair every day, and it's difficult aesthetically to use. In hair transplantation, women that are good candidates get great results, as good as men. The problem is that some women are not good candidates for a hair transplant because their hair loss is diffuse, it's thinning all over. And when your hair thins all over, you don't have a stable area to get the hair from. The critical thing in a hair transplant is not only to have the need for it, and to have an area that's lost enough hair that hair transplantation will help you, but you also need a permanent donor supply. So once the hair is transplanted, it'll be permanent over your lifetime. And so we can evaluate a woman with densitometry to find out whether her donor hair is stable enough to make a hair transplant worthwhile.